Flipping means not doing the traditional thing where the teacher lectures and the students take notes, but making the classroom one where the students do a lot of the learning and the teaching among themselves, and the faculty is more of a guide, more student-centered, more student active, rather than just sitting there and listening. Well, the class that I flipped is Pathophysiology. It's in the nursing program, and pathophysiology is what goes wrong in the body when you're sick or when you're injured or anything happens untoward. And it's a very conceptual class. You really have to understand what's going on in the body. It's not like you can just memorize a lot of stuff. You need to understand what's going on so that you understand what the person is experiencing and what the outcomes will be, and how we're going to take care of this person. So it's a real fundamental class to nursing. And this seemed to me to be a good class for flipping, because I wanted to get this, students take it in their very first semester of nursing, and I wanted to get them out of the, you stand there and talk and we take notes version of thing, and then we go home and memorize it, and that's it. And I wanted them to really get into working with the material and understanding it. So I thought this was a good class to do it with. I used to teach it straight lecture, and I was always rushing to get through the material, and students, some classes asked a lot of questions and some classes didn't, and when they didn't, I was always afraid, like, well, they're not getting it, they're just too shy to ask questions or something, so I always worried about whether they were really understanding what was going on. And then the tests would come around and I'd say, oh yeah, they really didn't understand what was going on. So I chose this class for flipping. And in flipping it, I made it so that for most of the semester, the students are doing more of teaching each other and themselves than they are of listening to me. So the first few lectures, which are the really basic concepts like inflammation and immunity, I still lecture, because I want to make sure that they're really with me, and I can ask them questions and they can ask questions, and we can really get to understanding of those basic concepts. But then when they've got that, then we move into all the different disease states. And so what I do is I record my lectures. I use Camtasia Relay. I record my lectures. I put them online on Blackboard. And I tell the students that they must listen to the lecture before they come to class. And then in class, what we do is I use clicker questions. I use clicker questions when I'm lecturing, too, just to make sure they're following. But in the flipped classroom, the clicker questions become very important, because I use them to start off discussion. And what I normally do is I have them answer a question, and then I have them talk to each other about the answer, and then I ask the question again. And what I have found is that most of the time the outliers disappear, and the answers group more around, the two answers that students say, well, I got two answers looked right and I couldn't decide which one. And so the outliers disappear, the answers group more, or they all get it right. And they have taught them each other by talking about it, and they can look at their notes and their PowerPoints, and they talk about it, and they teach each other that way. And when they don't understand, I can go through and say, well, this answer is right because, and what makes this answer right and the other answer wrong? What's the problem with this other answer? What makes it wrong? And I can make them think about it more, and really get into it a little better. But what I have found is that there's two things that really help the students, and one of those is concept mapping. And concept mapping is a thing you do where you put the main problem or the main idea in the center, and then you work out from there. And you put, okay, well, this goes with that idea, and this goes with that idea, and oh, these two things match each other, or they're connected to each other. And concept mapping helps them to see the whole thing. And then the other thing I do is case studies. And I have a variety of case studies where they're given an imaginary patient, they're given the information about the patient, and then they're asked questions. Why is the patient's serum sodium high? Why does the patient have these symptoms, what's going on in the body, and then they work in small groups to answer those questions. And then the groups come up and present to the whole class there, because they all have different case studies, and they present to the whole class. The other thing that I have found from student feedback that works really nicely for them is when you group disorders and diseases. Like I have this thing that's called dyspnea derby, and dyspnea is difficulty breathing. So there's lots of diseases that cause difficulty breathing. So I give each group a different disease, but all the groups have the same questions. You know, what causes this disease? What are the risk factors? What's happening in the body? How do you treat someone with this problem? And then we can bring it all together, and we can say, okay, you know, what causes the disease, and we can go through all the different diseases, and then, you know, what are the risk factors and what's going on, and it helps the students to see what's alike and what's different. You know, what are all the similarities that these diseases have? What are the differences that they have? What difference does the differences make? Do the differences make? and it helps them to get a broader picture of the whole thing, instead of just memorizing symptoms for, you know, a dozen different diseases. They get a broader picture. I can't say that I've seen any drastic changes in the testing, but I have heard, and this is anecdotal, from faculty in future semesters, that the students seem to have a better grasp on what they're doing. The kinds of activities they're doing with the case studies and answering the case study questions are similar to the types of questions I'm asking on tests, because I usually ask a situation. You know, this patient has X and so, and this is going on, and what is the underlying problem, or what would you expect to see happen next with this patient because of the pathophysiology that's happening here. So they're very similar. And the clicker questions that I ask are very similar to the types. They're really thought-provoking questions where you really need to understand what's going on in order to find the right answer. So I tried to give them as much practice as possible for answering those kinds of questions. And even just learning to work with each other in small groups is very important, because that's what you do when you work, like in a hospital. You're working with a small group of people, and you have to learn to cooperate and learn to help each other, and also learn to be able to say to each other, no, that's not right. You know, you're on the wrong track there. So in many ways, it helps mirror what they really are doing will do in clinical practice. The student load is a little bit heavier when you flip it, because they have to listen to the lecture first instead of listening to it in class. The reading and stuff is pretty much the same for both. However, what I have found is that when I record the lecture, it takes a lot less time than when I give it in class, because I'm not stopping to answer questions, I'm not stopping for a break, I'm not, you know, there's none of that stuff going on, so it goes much faster. So listening to it is faster than it would be in class. Most students listen to the lecture. They don't really remember it all yet, but they listen to it. Occasionally a student will admit that they have not listened, or that they only listened to part of it. But they lose then, because they're behind when it comes to doing the case studies and the concept maps and answering the clicker questions. Now, if you want attendance, ask clicker questions, because they count. Now, they don't count a lot. They count 10% of their total grade, all of them together. But it makes students show up, especially when you ask them through the course of the class session. You know, they can't come and answer them and leave. You know, they answer them and they stay, because they're getting those points. You know, so clicker questions are, I call them the participation points. And clicker questions are very useful for a number of reasons. It is in a way more work to flip the classroom, because, you know, we're so used to lecturing. You know, you can just pick up your notes and stand there and do it, and you've done it umpteen times before. So lecturing is in many ways easier, But flipping the classroom is more fun. It really is. You have to put some work into it. You have to come up with the activities to do in the class. You have to write the case studies. You have to, worry about that and make sure you've got everybody involved and go around and talk to them as they're working in their groups and make sure that they're progressing okay. But it's a lot of fun. You also have to be really flexible because you'll come up with different questions as they work through their things and as they present their stuff that you then need to be able to answer. And what I find is I can work off of the case studies that they do to ask the whole class more questions. Why is this the way it is? What's the connection between that and this other thing that we've already talked about? What do you see as the connections? And it's those connections that I really want them to make. So as a faculty, I find it challenging and fun to do a flipped classroom.